Okay, just want to say that be patient with me. This is my first time doing a YouTube video online instruction. The goal today is to do chapter 13, and we're going to do up to reflexes. The reflexes will be a part 2 of chapter 13. And I'm going to start that in a few minutes, but I just want to tell you that supposedly the camera puts 10 pounds on you, and nothing I can do about that, but just imagine how awesome I look off camera, right? Well, we'll have to see. So let's get started here. So first thing we're going to do is we're going to talk a little bit about the spinal cord and some of the layers and the central nervous system. Alrighty, so let's get kind of centered up here a little bit. Alrighty, that looks pretty good. So the central nervous system consists of the brain and spinal cord. Everything else is the peripheral nervous system. Spinal cord is about 18 inches. And the brain and spinal cord are surrounded by 3 layers of what we call meninges. And the layers wrap pretty tightly around the spinal cord and brain. Starting from the inside out, we have the pia mater, which I call like the cellophane. It's very, very tight, bound to neural tissue. Blood vessels serving the spinal cord run along the surface of the pia mater. The next layer going out is the arachnoid mater. Within this, we have a layer called the subarachnoid space, and it is filled with spinal fluid. It's clear. The spinal fluid is clear. It provides immunological protection to the brain, and it's a cavity within a cavity, which I'm going to talk about in a minute. And then the outer, tougher layer is the dura mater. That's the outer portion that fuses with the periosteum of the occipital bone. Okay, so let's talk about the central nervous system. And now it's a cavity within a cavity. And there's good that it's a cavity within a cavity, because if you were to get sepsis, some sort of blood infection, that infection could rapidly travel right to your central nervous system, and that would be devastating. So by having the central nervous system in its own cavity, it's kind of protected a little bit. So it takes longer for certain pathogens to attack the central nervous system. However, some pathogens are very, very deadly, and if they do make it past a certain point and they attack the brain or central nervous system, they're usually very deadly. For instance, rabies. Once you're diagnosed with rabies, it has a 99% fatality rate. And also spinal meningitis. Bacterial meningitis is very deadly. And if you were to get that, you could die very, very soon. It has a high fatality rate. So it's good that it's in its own cavity. Your brain and spinal cord are surrounded by spinal fluid. Okay, so let's move on a little bit. We're going to talk about some of the sectional organization of the spinal cord. So bear with me for a second. Oh gosh, here we go. Let's see if I can bring this up and see if this looks like it matches up pretty nicely. Okay, so we have 31 pairs of spinal nerves, and we have 2 major branches of spinal nerves, and if you can see, we have sensory and we have motor. Hope I'm pointing, I can't see from the other side. Let's see here, the dorsal root, the axons of the dorsal root are sensory neurons, and we say they are afferent. That means that's information coming into the spinal cord. And then we have motor neurons. We have the ventral, the motor axons of the ventral root, are efferent. That means it goes back out to your body, and that causes you to move, or something like that. So they join to form spinal nerves. In between, you'll see columns and everything. That's going to be chapter 15. Those have to do with ascending and descending tracks that go up to your brain and stuff. So we'll leave that alone. Now the term, we'll make sure that this is straight, still good. And hey, make sure you're not on your cell phone, okay? Thank you. All right. So let's see here. As you can see, it says somatic and visceral right in this area right here. You have somatic, visceral. I think somatic is here, visceral there. Yeah. Okay. So anyway, when we get into reflexes, which is going to be the part 2 thing, we'll talk about, it's going to be a little bit more complex. This is more kind of going in and going out. So typically, somatic means like skeletal, muscle, and bone. So if a sensory impulse comes in from that area, it's going to synapse, of course, in the somatic area, and then it's going to go down to the appropriate somatic motor neuron, and then go out to the body via the ventral root. So, and then same thing with visceral. Visceral means like gut. So visceral information coming in, sensory, will then go out through the efferent motor neurons. All right. So far so good. All right. So next thing we're going to talk about are spinal nerves and plexuses. So we have, as I said, there are 31 pairs of spinal nerves. Here's a picture of some of the nerves, and you can see we have, starting this one right here. Well, let me see what it says. It goes from C1 to T12. Okay, there we go. Perfect. Right, and then we're going to see some group of nerve plexus. We have cervical plexus, brachial plexus in this picture, and I'll talk about that in a minute. And then in the lower half, we have lumbar and sacral plexus. Alrighty, so that gives you a little information there. Let's see what it says. That goes from T12 to S4. Alrighty, perfect. Okay, so what are the nerve plexus? Let's talk about it. All right, so they are a branching network of nerves composed of afferent and efferent fibers. So afferent means sensory information coming in. Efferent means going out. Okay, again, some of the major plexus are cervical, brachial, lumbar, and sacral. So let's talk a little bit about those. All right, let me see, make sure that you guys can see all this. Excuse me. My elbow hurts. All right, cervical innervates neck, thoracic, diaphragm, muscles, and head. And they are in the C1, the C5 area. Those are the nerves. Brachial innervates pectoral girdle and upper limbs, and they run from C5 to T1. Lumbar innervates back, abdomen, groin, thighs, knees, and calves, and that runs from T12 to L4. And then we have sacral, which innervates pelvis, buttocks, genitals, thighs, calves, and feet. And that's from L4 to S4. Alrighty, so everyone can see that. Awesome. Oh, by the way, we need to come up with a name of my mascot up here. So, anyway, whoever comes up with a good name wins absolutely nothing. Okay, so let's focus on the brachial plexus. There are a few nerves here. Musculocutaneous. Let's see, we got that good. Median, ulnar, axillary, and radial. Again, these group of nerves innervates pectoral girdle and upper limbs. Okay. All right, now we're going to kind of focus like why this could be important neurologically if you maybe have an injury or something like that. So, excuse me. We have a picture here of a couple nerves. Let me see. Whoops. Radial nerve, ulnar, and median nerve right here. So, for instance, sensory function in the hand is serviced by these three nerves of the brachial plexus. Compression of one or more nerves at the wrist causes changes or loss in sensation in areas innervated by affected nerve. In other words, if you had carpal tunnel syndrome, these nerves could be affected. So, do you have carpal tunnel? I don't know. Alright, so again, talking about injuries and things, we're going to talk about, it's a term called peripheral neuropathy. So peripheral neuropathy is basically some sort of injury, could be sensory or motor, could be from trauma or compression. Let's see, so injury, systemic injury, infection, inherited disorder. Some symptoms could be tingling of hands and feet, sharp stabbing pain, numbness in hands and feet. So that's that for peripheral neuropathy. Lastly, what I'm going to talk about is dermatomes. So this is kind of interesting how this works. Dermatomes. So this is basically in a cutaneous level, kind of shows like certain patterns on the skin, how spinal nerves innervate the skin, certain areas. So, for instance, what is important to a doctor? I'll try and get this closer for a second. It's kind of hard to see. You can also access this on Canvas. Let's see. Okay, I'll make it big. Make it small. Okay, anyway. Alright, so a patient, let's say a patient has sciatic nerve. A doctor really wants to confirm the diagnosis. One thing, the sciatic nerve is the largest nerve located in the neck. Excuse me, neck. Huh. Can you imagine if your sciatic nerve was in your neck? Ew. It's located in your leg. Signs and symptoms of low back pain usually are kind of key indicators that you have sciatic pain. So looking at the dermatome map, they might have numbness and tingling on top of the right foot. The doctor could recognize this as a problem with the nerve at L5, which would be the sciatic nerve. Okay, so that was just part of the chapter. Look at this, and then let me know that you've watched this. I'm not sure if I'm just going to do one complete test for chapter 13 or just do it in the two parts. Anyway, so over and out. Stay safe.